absolutely shocking story, this, people. The number of people in England waiting to start routine hospital treatment has reached a record high. We all knew it was coming, but now it's here, and I feared this is not the worst of it. 7 million people were waiting at the end of August. That's up from 6.8 million in July, and it is the highest number since records began in 2007. It's starting to look like those predictions that we might end up peaking at around 12 million people could well be true. Meanwhile, the number of people waiting more than a year has now reached 387,000, and the government and NHS England say that they want to eliminate all waits of more than a year by March 2025. Well, good luck with that, the way things are going. I am joined now by Dr. Emeka Okorocha, who is an A&E doctor and author of Your Health in Our Hands. Thank you very, very much. Great to have you on the show. It's actually the first time I've seen you sat down. The only other times I've seen you when you've been in here in person, and you are absolutely huge. So now it's nice to be at exactly the same height as you. So there we go. Thank you very much for coming onto the show. Look, this is...
Yeah, it is.
This is pretty bad, right? 7 million people, and presumably only going to get worse. How bad do you think this could get?
Honestly, it's more than pretty bad. It's terrible, because when you look at some of the targets that we set ourselves in the NHS, obviously we set ourselves very high targets when it comes to patient care. In terms of, for me as an A&E doctor, we have targets of seeing a certain amount of patients as a percentage within 4 hours of coming into the hospital, making a planned decision and treatment. That should be around 95%. However, it's fallen to about 71% on average. And when you look at in GP centres in terms of 2-week wait referrals, now these are referrals that when we think there may be a suspected cancer in a patient who presented in the GP and we need an urgent diagnostic test, this should be about 93%. And again, this is around 70%. So it's not great at all. And what I fear is this could get a little bit worse before it gets better.
So
however, there are plans in action to hopefully
just to clear something up for you, right?
Change things.
Just to clear something up for me, because 7 million people currently on an NHS waiting list for, as far as it says, routine treatment. So what is a routine treatment? Is it stuff like a hiatus hernia? Is it things like if you've done your ligaments in your ankle or a dodgy hip? What's the cut-off point for routine?
So a routine clinic is what we consider something elective. So, for example, an elective operation. So if you have a hernia that's not life-threatening or completely debilitating and you're on an elective list for a general surgery, or if you have, for example, bad osteoarthritis in the hip and you're on an elective orthopedic list for a hip replacement, these are what we call elective lists. Or if you have like an elective clinic where you need to see a diabetic consultant about diabetic medication or control. These are elective clinics and operations, and these are what's waiting, because at the moment we prioritize the emergencies. So all these different surgeons and consultants in their different specialties will be prioritizing emergencies that come into A&E. For example, we prioritize a broken hip from somebody who's fallen. We prioritize that treatment for more than we would an elective hip for somebody who has osteoarthritis, because it can wait. It doesn't sound good saying patients can wait, but there's a hierarchy. And even when it comes to ambulances, because obviously the ambulance call-out times have also been something that's come up more. More people are calling ambulances for more urgent calls, and the times for wait for ambulances are growing.
Well, there are more people as well as the thing as well.
Yeah.
You know, our population is growing by the day. But just on this now, there's a recruitment crisis apparently in the NHS. There's not enough staff and not enough resources, and a lot of the staff that are in it want more money. So one of the things that I'm hoping you might be able to clear up for me, right, is if you're being honest, if we paid the existing staff more money, do you think we'd start seeing waiting times go down? Or actually, do we need more staff as well as to pay our current staff more money?
I think both. I think obviously financial incentives are going to keep people from leaving the NHS. We've had a record number of young people, especially nurses, leaving the NHS to go to different professions or taking their skills to other places such as Canada, United States and Australia for better working life and for better pay. If we incentivize them financially, obviously this is going to keep people from leaving, which is going to give us more workforce, which is obviously going to help waiting times. But then you have the other part of the argument where you actually have to drive people to actually want to be in the NHS. And we've done a great program with filling spots with physician associates and other healthcare practitioners, which are aiding doctors and nurses to fulfill their jobs and helping. And we have seen a general improvement in 18-month wait. So it's not all doom and gloom. We are seeing improvements slowly and surely. But the main thing is to urge to the public that this may get worse before it gets better, especially coming up to winter. And
well,
it's not going to happen.
Yeah, I suspect it is. And rather depressingly, very often in this job, I read predictions, forecasts, whether it's political polls or whatever. They're almost always wrong. However, the numbers that we've hit now, which is 7 million people waiting for routine treatments in the NHS, these were predicted. And so if the other stuff is true as well, we could even hit 10 or 12 million, which, fingers crossed, we don't.